Stop feeling overwhelmed by Med-Surg. I will share my three-part method from essential key terms to concept mapping and NCLEX practice that helped me to ace my exams. In this video, I will show you my powerful study hacks that breaks down every chapter into three simple steps: terms, map, and practice questions. Welcome future nurses. I am Nurse Mia and welcome to GetZen RN Study Group. I know what it feels like to be overwhelmed by the pressure of nursing school. I've been through the impossible reading assignments, the long commutes, and even I failed a class. But that experience was my turning point. I developed a unique method to master the material, and I am here to share it with you. We'll break down everything from key terminology to complex NCLEX questions so you can feel prepared, confident, and proud of your progress. Join me and let's turn that fear into confidence and get you ready to pass. Let's do this together. Ever open a Med-Surg chapter, see all the bolded terms, and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Hi guys, you might know what the wound looks like, but one single word in question can completely change your answer. Let's break down the key terms that make every wound care question on the NCLEX. This one word changes the whole wound care questions. So let's look on what those words actually mean, because the NCLEX isn't testing how many terms you can memorize, it's testing if you can see the difference between them. So let's go through each term one by one and connect to the what the question is really asking. So now let's go over to the wound care words that can really change on how we answer the question. Med-Surg chapters are about 50 pages long, and half of the time you can't tell what is important. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters. Chapter 17, Concept Map. We have Introduction, Post-Anesthesia Care Unit, Patient Care in Post-Anesthesia Care Unit, and lastly, Patient Care on the Inpatient Unit. And also they have subcategories, and I go more in detail as the chapter comes along. Welcome to Chapter 49, Assessment of Integumentary Function. It's a comprehensive clinical guide to evaluate the body's largest system. So the learning objectives By the end of today's video, you will be able to describe the anatomy and function of skin, hair, and nails, perform a systemic integumentary assessment for skin, hair, nails, recognize common abnormal findings and age-related changes, use the Barden scale to assess injury risk, pressure injury risk, document findings and understand relevant diagnostic studies, educate patients on skin health and self-care. This is the concept map of the chapter. You see they have introduction. Let me take my pen. They have introduction, has an overview of anatomy and physiology because it's assessment. Then assessment, that it's like nursing assessment. The age-related skin changes, every chapter has this, and the diagnostic studies. And at the end, I will provide a summary and some clinical notes. So if you go in the details, like here in anatomy and physiology, I explain this, and each slide has, I explain more about here, and which is the skin, hair, nails, and the 5 major function of the skin, which we talked, this protection, temperature regulation, vitamin D, sensation, and excretion here. The assessment, it's the history to identify existing condition, like the risk factors. The physical assessment, it's like color, moisture, tissue changes, lesions, and primary skin lesions, secondary skin lesion. So basically here I said in key terms about what those means, but I'm gonna re-show you again. The Braden scale, I have a little table, hair assessment, nail assessment. And then for the age-related skin, which is very fragile, longer to heal, prone for condition, low collagen, low elastin, and then they have age-related skin condition, eczema, like herpes zoster. Then for the diagnostic, we have the laboratory diagnostic studies, significance of abnormal values, and the nursing implication, like what we have to do. So that's the whole chapter. It's a little bit long, but I hope we'll get it faster. Do you struggle to understand how the NCLEX is asking you? Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter, NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. Do you know how the chapter correlates with this NCLEX by in order to pass your NCLEX? Do you want to practice NCLEX questions using this chapter as a guide? In this chapter, I present patients with skin disorder.
We finally made it!
Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.